excited to be hosting this and for people to join the conversation. And I'll pass it over to Hashim. So I'm based in Zimbabwe primarily, but right now I'm joining in from Nairobi, Kenya.
Thank you very much, Tinashe. Hi, everyone. Once again, I'm Hashim Mpati. I'm from Benin and based in Benin currently. I'm a medical doctor by training and public health researcher specializing on urban health, climate change in the context of the West African coastal countries. So that's where all my focus lies. And I've joined Tinashe a year ago now with the Journal Club management, etc. So I'm very happy to be here and happy to, yeah, to learn from all of you, especially Christine. And I know that Maria Inti as well. I'll share the link to your work and yeah, we can see if there are parallels to make. Thank you, Tinashe.
Would you like me to continue, or is there anyone else?
Yes, I think people can just jump in and briefly
Okay,
introduce themselves.
great.
Yeah.
Okay, so I wanted, just thank you for this invitation. My name is Christina Kengai. I'm an assistant professor at Emory University in the Department of Environmental Health. And I'm an epidemiologist by training, and I study environmental determinants of chronic disease outcomes. And my work, I started and looking at chronic disease outcomes such as respiratory diseases and cancers. And I eventually, in terms of like disseminating my work, to public health professionals and to the public, I would field questions about exposures of interest. So a lot of my early work focused on air quality and air pollution. And I started my career at Washington University in St. Louis, and I would go out and present the work that I was seeing with air quality and cancer, breast cancer in particular. And I would get questions from the community members that I was presenting to about other environmental exposures. So there was a lot of concern about flooding in some of these low-income neighborhoods here in the US, and concerns about other environmental contaminants. And I realized that, I was really narrowly focused on this one particular exposure, air quality, where there were different factors in the environment, from access to food, other social factors such as maybe violence or maybe unemployment, that all were connected to health and connected to these outcomes. And so I began to expand my work, just going beyond these chemical exposures to thinking about social factors as well. Around the time this is happening and I'm expanding my work, I started to connect with some researchers in the School of Social Work. And in particular, an environmental social worker who was tackling climate change as what's the phrase I want to use? As climate change is one of the, it's one of the emerging public health threats, but it's also one of the emerging social threats as well, because as you know, with disruptions to the environment, that leads to social disruptions in terms of ability to work and provide income and different kind of disruptions to society. So that is kind of background. In fact, I don't think I'm sharing my slides. Are you able to see my screen now?
Yes. Yes.
Okay. Okay. And so one of the things we wanted to do, we've noticed that in my field, environmental health, climate and health it was an emerging area of research in our field. You know, we were approached in terms of doing some work looking at climate and health research in under-resourced communities here in the US. And of course, you know, when you're beginning to study a new area of interest, you go and you do a literature review, you know, and so what we found in terms of, you know, in terms of wanting to synthesize the literature, there was a huge challenge in terms of how do we synthesize the literature on the impacts, the health and social impacts of climate change, where most of the weight of evidence reviews were either, you know, they were focused specifically on kind of, in my field, environmental, like chemical exposures, and physical health outcomes. And what we saw was a need to expand our reviews to encompass some of the social factors and other factors that are associated with climate, are the results of these disruptions to our climate. So what we found is that there wasn't really a tool out there that did that. And so we decided, okay, there's not really anything out there, but there will be many people, as we're learning in this call, who are interested in climate and health research. Maybe we can, based on our experience in trying to synthesize the literature, maybe we could make some recommendations on how to synthesize the evidence. And so that is the origin of what we called the change tool. As I mentioned, and you all are aware, you know, climate change, it's one of the biggest global threats to human health. And there's been this rapid increase of publications related to climate and health. Here in the US, there's been a lot of focus on extreme heat and the climate-related disasters and health outcomes. And there's just been an explosion here in the US and outside of the US globally in an interest in climate change and its health impacts. But there, as I mentioned, there was we lacked a kind of standardized way to kind of assess the quality of the work that was being done. And the current tools that existed, they didn't really address the complexity of what you're dealing with when you're dealing with climate change, excuse me, because it's not only an environmental disruption, but it's also, you know, a social disruption and an economic disruption. And so we wanted to kind of develop a tool that could encompass all of these different aspects related to climate-related impacts. So why are we doing this? You know, climate exposures, our changing climate, these are long-term exposures, these are global exposures, and these are multifactorial. And the research that's being done is from a variety of fields. It varies in terms of like geography or what kind of exposure you're looking at, what are the outcomes you're looking at, and the population. So it's really a global multifaceted exposure. And of the tools that are out there, and unfortunately, I should add that I can definitely say here in the US, you know, climate change is a political issue. There are a lot of political and economic interests in you know, some of the work that we do. And so kind of the conventional systematic review tools that were out there, they kind of were I don't want to say ignoring, but they did not cover the multifaceted aspect of climate change, and also some of the other factors that we think people should take into account when studying some of these issues and evaluating the work that's been done, particularly issues that involve relative to funding, who's funding this work, and then also, you know, back in my origin story there, how you're engaging communities that are impacted by climate change. I thought recently with the work that's focused on social determinants and anti-racism, it's really important to incorporate the people who are impacted by these exposures into the work. And we really wanted a tool that would encourage researchers to account for community engagement as well. So we wanted to develop a tool that was interdisciplinary and also was transparent and ethically transparent. So I have, I worked on this tool with some colleagues, and one of my colleagues is really good at developing acronyms. And so the change tool is an acronym for climate, health, analysis, grading, and evaluation tool. And it's a tool that we think would be useful for assessing exposure, response studies, so looking at the relationship between an exposure and a health outcome. It can be useful for evaluating or assessing the literature on interventions. And there are also, as I mentioned earlier, there are existing weight of evidence tools out there. And so OHAD is a tool that is used in chemical environmental health assessments. And we think that this tool can be incorporated into that evaluation. So it's not meant, there are aspects of the tool that we encourage the adoption of in other frameworks for evaluating climate and health research. So the tool involves like a two-step process. First, we want to kind of classify, when we're reviewing a study, we want to classify the study based on some important descriptions. And I'll get into that in our next slide. And then the second step, after we've classified the study, is that we want to assess a study's quality or its potential for bias. And we are, as I mentioned, this tool is adopted from different disciplines and the methods that they use. So we have drawn from environmental epidemiology, some of the earth sciences, and some of the social sciences in terms of how we would evaluate our tool. So the first step is what we call study classification. And what we want to do is classify the tool by what kind of exposures you're interested in looking at. And so I'm going to refer to the paper here. But some of the exposure types that we're interested in is, are you looking at precipitation? Are you looking at temperature, humidity, air pollution, coastal sea level rise, storm surge, flooding, wildfires? What is the exposure, the climate-related exposure that you're studying and are you evaluating in the study? In terms of outcome, so this is a tool that is focused towards health outcomes. So we're looking at both direct and indirect outcomes. So obviously, some outcomes may include mortality and morbidity, and some of, if you're dealing with maybe a typhoon or maybe a weather disaster, you can pretty much identify what is like an acute outcome that is associated with that sort of disaster. But for some of these kind of climate-related exposures like flooding, the impacts may be more indirect. Maybe someone has been flooded out of their home and that has resulted in a severe economic burden for a person in their family. That's an example of an indirect exposure where, or an indirect outcome where you have this economic burden, which then leads to an adverse health consequence. Maybe they don't have the resources to care for themselves, or maybe if they are someone who has a chronic condition, they can't adhere to recommended treatment because there are other factors that are much more of immediate and could result in having a patient that is unable to care for themselves, either due to financial strain or physical or mental health strain. So we wanted to emphasize both direct.
In brackets.
Is there a question? Oh, okay. So we wanted to account for both direct and indirect outcomes. The next is the time frame and spatial scale. So we said, as I said, like, climate change is an exposure that it's a long term. It's not an acute exposure, and it's important to take into account the time frame. And so what we have here is, we have studies that can maybe they're focused on a heat wave here in the US that it lasts for 2 weeks, or maybe a flooding event that lasts for a few weeks. But also, given that we are dealing with, climate and not necessarily a weather exposure, you could have a time scale that is much more long term. Also, we wanted to classify whether a study was kind of a cross-sectional study at one point in time, or maybe more of a longitudinal study. Maybe you're studying a population over multiple years or even multiple decades, as some of my colleagues do here. And so it's important to kind of document the time frame and the spatial scale, of course. So are you looking at maybe an outcome in a particular city or neighborhood or village versus like what is happening in North America, or what we would see happening in South America or Asia? So the spatial scale is important in terms of evaluating the work. Similarly, regional focus and population, you want to account for, who exactly we're studying. There are different impacts depending on the outcome you're studying and the population. So recently, we just used this tool to evaluate mental health outcomes, extreme weather events and mental health outcomes. And the paper is currently under review, but I did this with some colleagues in Nigeria. And so we were looking at extreme weather and mental health outcomes in West Africa. And we were looking, the most common studies were of those studies looking at flood, and a couple of studies that were looking at some extreme heat exposure. And we found that the target populations varied throughout these studies. We found a lot of studies that focused on agricultural farming communities, because some of these, especially particularly the flooding impacts, these are impacts on their livelihood. And we also, when we observe, there are mental health impacts. But we've seen studies also that are focused on special populations, such as pregnant women. There was one study where we were a lot of studies focused on, or not as many studies as we expected, looking at children. But it's important, you're seeing different outcomes, and particularly when you're looking at mental health. Here in the US, we see most of our mental health conditions, they are highly prevalent in the young adult population. And so when we're seeing issues related to climate anxiety, we're seeing these issues in our young adult population. But in some of the studies that we were looking at in other settings, we were seeing issues in other kind of special groups, either populations where the climate event would impact, either directly or indirectly, impact their economic security or their personal security and safety. Then we were seeing impacts in more of an older population. So it's important to document your target population of interest. I think what is new or relatively, to our knowledge, we haven't seen in many weight of evidence reviews, is this idea I mentioned of community engagement. So are you incorporating indigenous or local or community knowledge? Are the researchers incorporating that knowledge into their study? For some of the larger studies, no. For some of the more smaller, more localized studies, especially, we saw this in our West Africa review. Very happy to see that some of the local cultures and customs were incorporated into the analysis of these studies. I think it's more common in work that's done outside of the US than some of the work that we've seen inside the US, unfortunately, for us here. And then, as I mentioned, you know, funding, where is this coming from? Is it, you know, is this working fueled by, you know, a party who is in the fossil fuel industry? Is it being fueled by, you know, government, the federal government? This is important information, are funded by the federal government. This is an important information that should be disclosed. And then I think finally, the author affiliation, of course, is usually should be disclosed, and particularly any conflicts of interest, maybe from industry or from other consulting firms that are associated with the fossil fuel industry. So first step is we want to classify the study, and we want to account for all of these different factors when we are reviewing a study. The next step is that we, so this isn't as clear as I thought it would be. Hopefully you're able to see it, but it's also, this is table 2 in the paper, but after you've classified the study, then it's ideal to evaluate the study's quality and evaluate the study for bias. And so there are 5 key areas that we want to look at when we're evaluating studies for their quality and bias. The first is transparency. So we want to see, and those 3 transparency questions include, has the research question been defined? Has the inclusion and exclusion criteria been defined? Do you think that this study could be reproducible based on information that was provided in the study? Selection bias is important. Are the participants who are in the study, the people who were selected to be in the study, are they representative of the target population? And this is important because you are asking the question, can the findings of this study be generalizable beyond this study sample? Covariate selection is important. You want to account for confounders in the analysis, and you want to make sure that the covariates that are selected are appropriate for the study type. Detection bias is a question of whether the exposures you are measured, whatever you're using to measure your exposure, is it a valid and reliable tool for measuring the exposure? So for an example here, I mentioned we do a lot of work here on heat. Oftentimes we're relying on temperature that is provided by thermometers from the federal government. And so you may be relying on a measurement that is, you know, maybe a couple 5 or kilometers, you know, 5 kilometers or 3 miles away from where a participant is living. And so is that the most valid way to assess temperature in someone's home if you're relying on a measurement from a couple of miles or kilometers away? Similarly with our outcomes. So one of our challenge I mentioned with the mental health review is that it's very hard in our study when we were looking at in West Africa, it's very hard to find, or even here in the US as well, it's very hard to get an assessment of the prevalence of mental health disorders in a population. It's difficult to diagnose. There's not really what is kind of reported here are the extreme events. You know, someone has come to a hospital and needs to maybe have to spend a few days in the hospital, needs to be institutionalized. That's an extreme event versus someone who may be experiencing depression. And we don't really have the surveillance system to capture that here. And we also saw it in some of the West African countries we were looking at. So that kind of detection bias, you know, it's a limitation. And it's important to account for it. It doesn't mean that the study is invalid, but it's important that we account for it. So we want to make sure that the tools you're using to measure your exposure and the tools that you're using to measure your outcome are valid tools, are reliable, and are consistently applied throughout the study. And then selective reporting bias. This is a big problem in climate and health research in general, in that usually, unfortunately, some journals are not as excited with null results as they should be. I mean, a null result is a result, and I tell my students, yes, this is a result that should be published. Unfortunately, the journals don't always think that way, and so what you often see is that what is presented to you in the literature are either are results that are significant, statistically significant, maybe clinically significant. We're unable to really figure out if the null our studies with null results that work is disseminated as much as it should be. And then also, there are instances where a group of investigators may be studying multiple exposures and multiple outcomes, and then they only see a result for maybe one or two exposures or outcomes. Ideally, you should be reporting all of your results, not just your significant results as well. So this is something you kind of look for when you're going through and evaluating an article to kind of identify, are the investigators, are the researchers reporting results on what they said they were going to investigate and study. So in terms of how you will use the tool, we think it's important that you have two people evaluating each study. So in a review, and I can again give you an example of our review we just completed. We identified 15 articles over this 10-year period, and we had two members of our team read each article and grade each article according to the change tool. So you want to have at least two people grading each study. And then the third reviewer, which is me or my colleague, if there's any discrepancies between the two, you have a third reviewer take a look and discuss among the reviewers to resolve the discrepancies. So that is, how we apply the tool, and to kind of wrap up in terms of like the future use, we think that using this tool will improve, consistency and transparency in terms of these systematic reviews. And in addition to our systematic reviews, I think the tool is also helpful for those of you who are teaching students. It's helpful in helping your students to kind of maybe they're working on a thesis or designing a study or going through an exercise. And so it's also helpful in kind of planning your research as well. And so I think the tool is useful not only for conducting reviews, but thinking about as you're writing your research or planning your study, things that you want to take into account or describe in your manuscript. Big picture, with all of these systematic reviews, the purpose of these reviews is to support public health policy, support decision-making, and support how these results are communicated to the public. And then we kind of threw this in at the end. So we published a review last year, just as these AI tools were beginning to pick up and be incorporated more into people's work. And we could see, I'm not, I don't have the expertise, but we could see that this tool could be adopted into or could be assisted and could be adapted for an AI assisted use. So I could see maybe, you could have a programmer that could program some of the criteria into a tool that could help, AI could be used to help some of the reviewers. I do not think, and this is me and my lay opinion, but I don't think AI can replace a trained scientist. And so I'm a little cautious, and I went back and forth with my co-authors on this. But I think that these tools are, in general, I don't think AI can replace us, but I think they can be an aid. And so I will rely on my colleagues in computer science and those who are more technologically savvy to think about ways that we could use AI to aid our systematic reviews. So just to wrap up, we think this tool kind of fills a critical gap in climate research, just because it's much more interdisciplinary in terms of some of the criteria that we've included in the tool, and it encourages researchers to expand beyond their area of expertise, to think, social scientists to think about some of the health sciences and environmental exposures, and environmental scientists to think more about some of the social issues. And also with the community engagement part, we think that it's important and fills a gap. And we're hoping that you all will use it in the future if you're doing any systematic reviews, and to kind of standardize how you evaluate this literature. And I think, if not this tool, there are other tools, Cochrane, and so there are all these other tools that are really important for us to produce more rigorous work, which can then be much more impactful in terms of influencing policy and advancing public health. So I will stop there, and again, thanks for this invitation, and I'm looking forward to chatting with you and learning more about your work.
Thank you so much. Thank you so much for the presentation. I have to say, when I came across the paper, I'm invited to peer review articles, mostly in global health space, and so this time around I have a paper that I was asked to peer review, and it was on climate change. So it's my first paper to review. So I've contributed to a paper on climate change and health. So I didn't know where to start in terms of, okay, how do I really approach this in terms of peer review? And I think is like really going through the the tool helped me a lot in terms of just to start thinking about things to look out for. I know like this is not a a systematic review in any way, just looking at one paper, but I found it useful in that regard. I also found it useful when I was really looking into when I was reflecting on some of the conversations that I've had with colleagues who are doing research on the impact on heat. I know there's a multinational research going on impact of heat on maternal health outcomes, and some are now considering incorporating air quality. So when I was reading some of the suggestions on the two, I think you really bring a lot of important points to even consider when you are conceptualizing the research, and not only when you're the article in itself, but really thinking about the research. And I liked the transdisciplinary approach to it, which is something that we struggle a lot particularly in the health space, because people tend to work in silos. We really need to be pushed more to do that. And really the emphasis on the equity. I think this is one thing that be should be become the norm in terms of really thinking about equity. So thank you so much in terms of and thank you for joining this conversation, and thank you for the two. So I'll open up the space to questions, comments. So feel free to just briefly tell us who you are, then you can ask your question, or you can share your comments. And feel free to unmute. We're a small group, so go ahead. Thank you. Go ahead, Maria.
Christina, thank you so much. This was such an interesting presentation. Also, you know, coming from a Cochrane perspective, where we have been developing instruments and tools for so long to assess and the quality of studies and the risk of bias. It's really exciting to see that you are taking this approach from a very contextualized angle, which is specifying on climate and health links. So what I find especially interesting is that I would say the Cochrane approach would generally be to say, okay, we have this topic we want to tackle which would be the study types that would be eligible to answer this, and then we would specifically look for the study types and then assess their risk of bias, for example, of cohort studies, right? And I guess your instrument would be a bit more broad and say, okay, what is the question that interests us? And then we try to identify any studies regardless of the study type, and then try with this instrument to assess their quality and assess the risk of bias. So I was wondering, and sorry for this long introduction, could you maybe say the pros and cons of using like the Cochrane approach of selecting the study type first, or compared with your approach of considering maybe all study types?
Yes, thank you for this question. And I will tell you what we just did with this review I mentioned. We did both. So we realized, I think what our approach is kind of, we have two steps in this review, but in the review that we just completed, our approach was, this was our change tool was a first step. And then what we ended up doing was then leaning on another tool, because we in that review, we found that we'd had a lot of qualitative studies. And so we needed a more detailed qualitative review. And so I think the limitation of our work is it's a kind of, what do I want to call it? I don't want to put down our tool, but it's kind of a scratch the surface and kind of just summarize what, what is exactly out there. And we recognize that this is a transdisciplinary issue, and we wanted our priority to acknowledge, our tool to acknowledge that the transdisciplinary and the multiple factors that are associated with climate change need to be accounted for in a review. What ended up happening as we were working through our review, we get to where we are evaluating bias, and we needed a little bit more help in evaluating bias for those qualitative papers. So then we pulled on another recommended qualitative specific tool that was used here, developed by the NIH here. So I think I am comfortable with an approach that I don't think it's one size fits all. With this issue, it just can't be. And I think we mentioned in the paper, we can, this tool could be an additional step in an environmental epi tool, the OHET tool that we mentioned earlier. But we think this tool could be an additional step in other weight of evidence reviews as well. So I don't think it can be a standalone evaluation. I think it's meant, because it's so broad, it can't get into the details that is necessary for the different study types. And I think it can be a tool that's used in conjunction with other tools.
Thank you.
Thank you in the chat for, it's good to meet everyone, and thank you for sharing these resources.
Yeah, and feel free to unmute if you have a question or comment. Would really love to hear from all of you on the call. Or even reflections in terms of how you think this tool can be very useful in your ongoing work.
I was very pleasantly surprised to learn, Tinashe, that you were using the tool to aid in a review. So thank you for sharing that. And if anybody
Yeah.
has used the tool or has ideas of how they can use it in your work, please share. The origin of this work, I was working with a doctoral student who was, encountering challenges and synthesizing their literature. And so we kind of developed this approach, and then, we pushed him to publish it. And so it's great to know that it's will be of assistance, or has been of assistance, and in ways that we did not even envision when we wrote it up.
Yeah, yes, indeed. Because I think with everyone, even when I talk to my colleagues about climate change and health, and even generating evidence and how to think about indicators, how to think about all of that, it's 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 been hard. So I think as we're starting to have tools that can help in terms of structured thinking. It makes it a bit easier in terms of what to look for, and then even like for people already really looking some work in terms of the reviews that are there, because sometimes it can be it can be overwhelming, like without any structured guidance, especially in a new emerging field where sometimes you have faced yourself in your own institution where you're actually the one who's starting initiating some of the work that's there, and or you're leading it, you're the one who's leading the work, and there's no previous work or previous experience. You don't have prior experience that's relevant to climate change and health. So it's very helpful. It's been very helpful. Thank you.
What I wanted to add, and I'll just share my screen. We have been, so I think I told you all earlier I wasn't the most tech savvy, but I think, let me see. In the reviews, so we have applied it to a couple of reviews, and where we see like the weakest papers we've seen have to do with this issue of detection bias. Are the measures you're using to assess the exposures, are they valid? Are they reliable, and are they consistently applied? And so I see that's kind of what I've seen in our work here in the US, and even in the work we've done looking at those West Africa studies. It's, are you, your exposure assessment and then outcome assessment. And as I mentioned before, there are valid reasons for why outcome assessment is so poor, particularly those indirect outcomes. And so I think if there's any area where I could see that there's a need for improvement in this work, it's really in how we're measuring the climate-related exposures and how we measure the health outcomes. Maria, I see your hand is up again.
Yes, I don't want to take up time from other people, but I noted no one was asking questions, so I dare to ask another one. I would be very much interested in your experience based on the temporality of outcomes, because of course in climate change you can have a very important exposure such as a storm, right? Which is relatively easily defined, or it's very punctual. And then there are other exposures that can have a very different temporality. You mentioned it in your talk. For example, within heat waves, there's no international definition or clear definition of a heat wave. Is it 3 days? Is it especially the temperature during the night, etc.? And you mentioned that you are coming from air quality, and I guess the exposure, the temporality of exposure is also a very important consideration there. So how does your tool, or what are the recommendations within your tool to deal with this kind of very different temporality with regard to exposures?
Yeah, it's challenging. What we try to do is it's important just to characterize it, but we are not because the exposures are so varied. I don't think we can develop a tool to assess the quality of this exposure assessment. And so I think it will require like area specific knowledge to really assess the quality of making that dare I say, causal association between climate-related events or exposure and a health outcome. And this is not a challenge that is not uncommon in environmental epidemiology. You know, for a while here in the U.S., I don't want to call it my favorite example, but smoking and lung cancer. Right. And the evidence piled up, and the tobacco companies just denied. And from the Surgeon General report in the 1960s until the 1990s, over 30 years, it took for our at least at the federal level to finally acknowledge or for the companies to take accountability for an association between smoking and lung cancer. So it's always been a challenge to, identify or validate, I don't know if that's not the right word, but to establish this association between an exposure and a health outcome. And it's a common challenge in environmental epidemiology, and a really common challenge when we're thinking about chronic disease outcomes as well. So it's going to be a challenge in the future. And I think that's why we're seeing a lot of these kind of early studies that are focused on more of the acute event, or what is thought to be event-related outcomes.
Thank you.
Yeah, so our tool encourages investigators. I see a question in the chat. Does it support air quality monitoring? And so it encourages investigators to consider all the different types of climate-related exposures, which includes, poor air quality. And what we encourage people to do is to account for those exposures in the study, to characterize it as an exposure of interest. And then also getting back to the detection bias, make sure that you're using tools that are valid, reliable, and consistently applied throughout the study.
May I, Christine? May you tell us a little bit about how you came up with the step 1 criterion? And
So we thought it was really important to we actually sat in as a group and just brainstormed, what and really relied on the literature. What are some of what we think are kind of climate related exposures? And I suspect as there will be a revision to this tool, maybe in 5 or 10 years, but we wanted to really think about like what are the environmental exposures that are that we believe are associated with a changing climate. So to wrap it up, it's why we realize that there's no way we can capture all of those exposures. And so we have a category for general climate-related change and an other category. So it's really challenging because, as you know, we've mentioned repeatedly in this talk, that it's just it's a global transdisciplinary challenge. And it's hard to account for all of the exposures, but we just wanted to identify what we thought would be the most commonly studied that we've seen to date.
Thank you. So, Christine, actually, my question was on the study classification metric.
Okay.
So the items that exposure type, outcome type, etc.
Yes. Yes.
Yeah. So that was my question.
Oh,
How
okay.
do you come up with those?
Oh, the particular metrics?
Yeah.
We had, so we looked at other tools in environmental epidemiology. And those tools were really focused on kind of chemical exposures and outcomes. And so we've always kind of thought about exposure and outcome, the timing and scale of the exposure and outcome. I think what was really new, or what we thought it was important to include was, again, community engagement and indigenous knowledge, and then the study types. So in epidemiology, you're dealing mostly with quantitative studies, and we thought it was important to pull in, because a lot of these early studies we're seeing are qualitative or mixed studies with small sample sizes. So I think we pulled on what we've seen done in the field of environmental epidemiology, and then recognizing that there are some designs that are outside of epidemiology but are really relevant to studying climate and the impacts of climate change. We pulled some of those other categories from that literature.
Thank you.
All right, I know Kristen has to leave shortly. So thank you so much for taking time to have this conversation with us. And I think if you're comfortable sharing your email address in
Yes.
case people want to follow up with questions in the chat. So everyone who's joining us is just we joined the session. This is more like a space. The aim of this space really is to start really help each other, learn from each other, and build more capacity on particularly climate change and health. Because, like as I mentioned earlier, for a lot of people, it's something that's new in their fields, it's new in their workspaces, or it's something that they're passionate about, but they don't even know where to start from, what tools are there that they can apply. So the idea of these journal club meetings is for all of us to also learn from each other, share our experiences. So we're also open to suggestions on what topics we can cover, or if anyone wants to present anything, we are also welcome to that. This is a space for us to mutually learn from each other, like across countries and across contexts. Yeah, thank you. So I don't know if Hashim, if you have anything to say or any key announcements, anything before we wrap up.
So just saying thank you, Christine, and thank you everyone that was around and participated in this session. Thank you.
Yes, and thank you for this invitation. Thank you for having me. This is a great discussion. Please, I've shared my email. I welcome collaborations. And so if there's any questions or any way I can be of assistance, please don't hesitate to contact me.
All right, thank you. And thank you everyone for taking time to join today's session. All right, have a good day.
Thank you.
Thank you.